We now go to the honourable member for Vancouver Kingsway.
Thank you, Madam Chair. I have great respect for the minister and thank her for being here. But I must say that a lot of the answers from this government through the COVID crisis have been unnecessarily general, and I believe that parliamentarians and Canadians deserved clear and direct answers to responsible questions. So I'm hoping through the questions that I ask that the minister will do Canadians the respect of answering the questions directly if she can. My first question is, the U.S. Centers for Disease Control has released a vaccine distribution strategy which set a target date of November 15 for states to be ready for COVID-19 vaccine distribution. What is Canada's target readiness date for vaccine distribution?
The Honourable Minister.
Thank you, Madam Chair, and I do thank the member opposite for collaborating so closely on so many issues, and I must say that I do enjoy working with him despite our political differences. I will just say this, the provinces and territories are working right now with the federal government on their readiness plans, and I will say that as soon as a vaccine is available, we will be ready to deploy. We have Health Canada regulators working around the clock, as you know, to assess the vaccines that have applied for regulatory approval. We also have been working with provinces and territories to ensure they understand the specific requirements of the different types of vaccines, that they have the storage and transportation considerations under control.
Madam Chair, I wonder if I might.
The Honourable Member for Vancouver Kingsway, yes.
Thank you. I'd appreciate enforcement of that, please. Once a vaccine has been approved, U.S. authorities plan to begin distribution within 24 hours. Are there plans in place for COVID-19 vaccines to be distributed in Canada within 24 hours of approval?
Honourable Minister.
Thank you, Madam Chair. As soon as the vaccines are approved, they will be able to be deployed in Canada. We are very grateful to the hardworking team at Procurement Canada and Health Canada, who are working, as I said, very closely together to ensure that we are able to approve.
The Honourable Member for Vancouver Kingsway.
Thank you, Madam Chair. Millions of Canadians will have to be vaccinated across Canada if and when a COVID vaccine is approved. Who does the minister anticipate will administer the vaccinations?
The Honourable Minister.
Thank you very much, Madam Speaker. And the majority of vaccination will be administered by provinces and territories, in fact, who have sophisticated immunization systems already. The federal government does have responsibility for vaccination of some federal populations.
The Honourable Member for Vancouver Kingsway.
Thank you. On August 31, the Prime Minister said the National Research Council would be able to produce hundreds of thousands of vaccine doses starting in November and millions by the end of this year. Now, of course, not 90 days later, he says Canada has no capacity to produce vaccine at all. How does the minister explain this blatant reversal on vaccine manufacturing?
The Honourable Minister.
Thank you very much, Madam Speaker. What I can say is this, Canada has not been a large player in biomanufacturing for a number of years. We have invested money to increase our capacity as a country, of course, to prepare for future health crises like these, and because it's a valuable sector to have in Canada. But I will say this, I am confident that the 7 candidates that we have procured are going to provide the diversity of vaccine candidates that will ensure that Canadians can get
the Honourable Member for Vancouver Kingsway.
Thank you. Perhaps if the minister is not going to answer the question, she could do it succinctly so that I can get more questions in. Health officials also confirmed that this government failed to negotiate the right to produce vaccines in Canada, as other countries have done. This means Canadians will have to wait for a vaccine and lives are in the balance. Why did this government fail to negotiate the right to produce vaccine in Canada?
The Honourable Minister.
Thank you, Madam Speaker. In fact, what this government successfully did was negotiate the best portfolio of vaccines in the world with, in fact, more doses per capita than any other country. That is what this government has achieved, and we are so proud of this work that we've done on behalf of Canada and Canadians, and we'll continue to make sure that we are investing and we are moving rapidly.
Honourable Member for Vancouver Kingsway.
Thank you, Madam Speaker. Australia is a mid-sized federal parliamentary democracy like ours. They have a clear roadmap and strategy on vaccine distribution in just 12 pages, with clear lines of responsibility between their federal government and states, outlining their options and their priorities. They're also producing 30 million doses of the AstraZeneca vaccine domestically. In contrast, in Canada, we have a federal government who speaks in vague terms and won't give us firm answers on basic vaccine readiness. How does the minister account for this difference in approach?
The Honourable Minister.
Madam Speaker, we also have a plan. It is being worked out now with provinces and territories. We are confident that they will have their plans for immunization ready. In fact, many of the provinces and all of the provinces and territories have experience in immunization, and we'll be there to support them with the novel vaccines that will require extra attention.
Honourable Member for Vancouver Kingsway.
Thank you, Madam Speaker. Now, the Liberal government has rightly pointed out that Conservatives seriously eroded Canada's pharmaceutical capacity, perhaps most starkly when the Mulroney Conservative government privatized Connaught Labs, a publicly owned laboratory that helped produce vaccines and low-cost prescriptions for Canadians. But that was in 1986. The Liberals made no moves to create a public drug manufacturer despite many years of government since then. Will this government do so?
The Honourable Minister.
Madam Speaker, I think the Prime Minister himself has been very clear that Canada needs to invest and is investing in biomanufacturing in this country. We, I think, have all lived through an experience now in this pandemic and realize that Canada needs to assert its sovereign independence in its ability to actually provide medical supplies, vaccinations, and pharmaceutical goods, and we are making those investments.
Honourable Member for Vancouver Kingsway.
With COVID-19 cases surging at an unprecedented rate across Canada, Prime Minister has called on premiers and mayors to please do the right thing and act now to protect public health. Those are his quotes. But a growing number of public health experts are calling on the federal government to use its emergency authorities to coordinate a national response. Is the federal government prepared to follow this advice? And if not, why not?
The Honourable Minister.
Mr. Speaker, every step of the way, we have provided national advice and guidance through the Special Advisory Committee, which brings together all public health officers from across the country to work in collaboration to determine the next steps, to provide national advice and guidance on a variety of different issues. We'll continue to work with provinces and territories, support them in their obligations around healthcare delivery, including, for example, acquiring vaccines and distributing them at no cost to provinces and territories.
Thank you. Is the minister confident that current provincial and territorial control measures are sufficiently robust to address the resurgence of COVID-19?
Honourable Minister.
Mr. Speaker, every step of the way, this government has listened to our experts, our scientists, and our Chief Public Health Officer, Dr. Theresa Tam, who, as you know, chairs the Special Advisory Committee and works on national guidance developed with all of the other medical officers of health. We know that following science and evidence is the way to protect lives in this country. It is the way to get through COVID-19. It is
the Honourable Member for Vancouver Kingsway.
Thank you. Canada's pandemic warning system, the Global Public Health Intelligence Network, was the cornerstone of Canada's pandemic response capability. Yet this federal government effectively shut down GFIN prior to the outbreak of COVID-19. Former Liberal Federal Health Minister Ujjal Dosanjh called this decision a colossal failure. How does the minister explain her government's decision to shut down GFIN?
Honourable Minister.
Madam Speaker, when I heard that scientists within the Public Health Agency of Canada were not feeling that their voices were being heard as part of the team of the Global Public Health Information Network, I was alarmed, and that is why I've called for the external review, which has begun. I am excited to hear their findings, both from a retrospective perspective about how that decision was made, but also their suggestions to build the best public health information network in the world.
The Honourable Member for Vancouver Kingsway.
Thank you. The minister knows the NDP has introduced Bill C-213 in this House to create a structure to establish universal public pharmacare in Canada. She is also aware that this bill mirrors the Canada Health Act by allowing any province who agrees to provide necessary prescription drugs to their residents at no direct cost via our public healthcare system to receive federal funds to do so. This is exactly the same way we fund all other covered medical services, from hip replacements to cataract surgery to broken arms. Will the minister support our bill?
The Honourable Minister.
Madam Speaker, this government has done more to lower the cost of pharmaceuticals than any government in a generation. In fact, we have been working tirelessly over the last number of years to put into place ways to control the cost of drugs in Canada and to ensure that Canadians can access the drugs they need at a fair price. We're going to continue that work, Madam Speaker. As I speak, work is underway to stand up the Canada Drug Agency, a very important next step in ensuring we have the coordination nationally to pursue pharmacare.
The Honourable Member for Vancouver Kingsway.
As Health Minister, does the minister support public pharmacare or instead a private-public patchwork system?
The Honourable Minister.
My mandate letter from the Prime Minister asks me to create a universal pharmacare program. That is exactly what I'm doing.
The Honourable Member for Vancouver Kingsway.
According to industry documents reviewed by Reuters, the pharmaceutical industry has made a last-ditch offer to the Government of Canada to spend $1 billion over 10 years to block the coming into force of the amended patented medicine regulations set to go into force on January 1st. According to an industry estimate, the regulations would reduce drug companies' revenue by $20 billion over 10 years, $6 billion by the estimate of the PMPRB. Will the minister confirm that the Government of Canada will refuse this blatant attempt to buy regulatory benefits from the drug industry?
Well, Minister.
Thank you very much, Madam Speaker. The changes to the PMPRB are going forward. We agree with the member opposite that we must have lower drug costs for Canadians. There is no point in having access to drugs that are unavailable because they are priced out of the market for most Canadians. The PMPRB is doing the work that it needs to do, and we are very proud of our work to lower drug costs for Canadians.
Honourable Member for Vancouver Kingsway.
Thank you, Minister. Your government's 2019 throne speech called universal dental care an idea worth exploring. What steps has your government taken to explore this idea?
The Honourable Minister.
Well, Madam Speaker, our government has been focused entirely on COVID-19 and indeed some other projects such as the Universal Pharmacare program that he spoke about. I encourage the members of the Health Committee to study the idea of a universal dental care program. I think this is an excellent idea. And of course, they are independent and will choose their own topics of study, but certainly more could be learned, I think, through the expertise of the members on that committee.
Member for Vancouver Kingsway.
Thank you. Experts and public health authorities across Canada, including BC's Provincial Health Officer, Dr. Bonnie Henry, and the Canadian Association of Chiefs of Police, have called for the decriminalization of substance use and the provision of safe supply to bring this crisis under control, because the evidence shows conclusively that criminalization exacerbates the harms to those suffering and doesn't work to help them recover. Minister, your government has repeatedly claimed that it follows expert advice in responding to the COVID-19 pandemic, yet you have unequivocally ruled out this evidence-based response to the overdose epidemic. Can you please explain this contradiction?
The Honourable Minister.
Madam Speaker, I am so proud to be part of a government that understands that compassion and access to treatment and supports for people who use substances is critical in reducing the deaths from opioid overdose. But not only that, Madam Speaker, ending the stigma for people who use substances. I've worked extensively with the province of British Columbia as well as many other provinces. I've written to my colleagues across the country to accelerate their work. We have ensured that people can access programs that provide safer supply so people reduce their use of toxic street drugs. We have made it easier for communities to stand up safe consumption sites. Mr. Speaker, or Madam Speaker, the work continues. I will continue to work with provinces, territories, and indeed local communities on tools that they feel will help them manage opioid overdose and problematic substance use.
Member for Vancouver Kingsway, 1 minute.
According to PHAC's recent report on an equity-based approach to COVID-19, I quote, COVID-19 has underscored the inequities in health that are shaped by the social determinants of health, highlighting how these inequities may be exacerbated in the context of a pandemic and shown how they can aggravate and prolong the spread of disease, making the pandemic worse. Would the minister support the implementation of a guaranteed livable income to address the inequities shaped by the social determinants of health?
Honourable Minister. The Honourable Minister. You're on mute, sorry.
I'm sorry. Thank you so much, Madam Speaker. And I thank the member opposite for the question because, in fact, he's absolutely right. Poverty, lack of access to affordable housing, these are the things that actually make people more at risk of contracting COVID-19, but also, by the way, all kinds of other illnesses, and in fact, contribute to a lack of people reaching their full potential. That's why we pursued things like enhanced Canada Child Benefit, lifting 300,000 Canadians' children out of poverty. That's why we immediately moved to implement the CERB when we were asking people to stay home. We knew it was an important public health.
And we have to resume.